Hello, everyone. Welcome to today's edition of COVID Decode, where we here at ThePrint have experts live on air to take your questions on COVID and answer some of the common and pressing doubts that people have at this stage of the third wave. And today we are here to talk about COVID and children. With us today, we have the former Health Secretary, Preeti Sudan. She was also a member of the Independent Panel for Pandemic Preparedness and Response, which evaluated the international pandemic response and how different countries and the WHO handled it. Also joining us is Dr. G.V. Basavaraj of the Indira Gandhi Institute of Child Health. He is a pediatrician with on-the-ground experience treating children now through the pandemic, including now in the third wave. Along with our guests, we have with us our in-house expert, Abantika Ghosh, who's been doing some great coverage of COVID in India. And I'm your host today, Sandhya Ramesh. Welcome, Ms. Preeti and Dr. Basavaraj, and a warm welcome to all of our viewers as well. Now, as we know, the third wave is still washing through the country, and not just India, also many others. Along with that, we also have vaccination drives and booster shots being given. One thing that everyone, especially parents, keep asking now is, what about children? Children's education has suffered greatly, and schools now are closed in most places. As we're easing curbs elsewhere, should children start going back to schools everywhere? Ms. Preeti, if we could start with you, could you please give us an overview of what the pandemic response has been towards children, both internationally and in India? And what do you think has changed since May 2021, since the report came out?
Well, let's begin with our own country. I think it was on early October, the first week of October 2021, that a very comprehensive guideline was issued by the Department of School Education in consultation with the Health Ministry on reopening of schools. You remember we used schools as quarantine centers, and children were all at home. Online classes had started. So if you see those guidelines, then sanitation, COVID appropriate behavior in terms of social distancing, making children sit apart, reinventing, or I would say reorganizing the curriculum, all those things are there. Have a look at it. And so the schools slowly started reopening. But now with this, latest mutation, Omicron, and since Dr. Saab is here and he's a pediatrician, he'll tell you, we find that children are also being affected. So that's why in the health bulletins, I think MOHFW has been highlighting how they have been creating infrastructure of pediatric beds to deal with those cases. Thankfully, they are also recovering, but more we should hear from Dr. Saab. So, given this scenario, because children and the elderly and the people having comorbidities, they are the most vulnerable population. But you are right. You see, it's just as it was in the first wave, the second wave, and even now between lives and livelihoods. It's also between children's growth, their education, their mental health, and they are not getting sick. So it's a very difficult dilemma, I would say.
Dr. Basavaraj, what has been your experience so far in this wave? Have you been seeing kids who are getting infected? How has it been different from the previous wave? And how are their bodies responding to the disease of COVID patients who are kids?
Yeah, thank you, Sandhya. So let me come up with as a Secretary of Indian Academy of Pediatrics. It is a 35,000 pediatricians organization. When I was a secretary in the last year, 2021, we came up with a clear-cut guidelines with the Delta and Delta Plus, which was sweeping across India. School is one of the important things where we looked into the positivity rate of a Delta and Delta Plus. We came up with the guidelines in September 2021. We shared with the PMO as well as the Union Ministry of Health and Family Welfare. And we came up with the guidelines, school needs to be reopened. That is the one thing. There is no question of closing the school. Second thing is we need to decentralize the school reopening. That means the policy cannot be for the nation, cannot be for the state, cannot be for the district. It needs to be on the school level, where school development council is then one of the things where they can take a decision regarding that, within including the parents and the local administration and all. That was the one of the clear-cut guidelines we have came out. Looking into all the scientific evidence, we constituted an expert committee of the both nation as well as the international experts, and we came out with the guidelines we shared with the government of India in this regard. That's one of the things. And why we need to open the school, we have clearly demarcated it. Psychosocial issue is one of the major issues. It is a silent disaster. It is much more severe than that of a COVID-19. COVID-19 is not dangerous in a children, but your school not opening the school, that's going to be more dangerous. We need to reopen the school at any point of time. That's the one of the things we came out. Screening time is become exponentially. It is increased in the school going children and even the small kids. One side it is causing a malnutrition in the rural area, and in the urban center it is causing an obesity, depression, psychosocial issues. All these things is coming anything. And we know that bringing the children back to the school is going to be the major challenge in Indian context. So if they lose a habit of coming to the school, bringing them back to the school was very difficult. And the experience, what we had it in a Ebola virus, which was in a 2014 in the African countries, where bringing them back to the school was a major challenge. Even still, they are not able to cope it up. Looking at all these things into the consideration, we need to take a COVID appropriate behavior. No, closing the school is not the answer. We need to reopen the school. That's the statement of Indian Academy of Pediatrics, which is a 35,000 pediatricians organization, which is well respected next to the American Academy of Pediatrics in the world. So that's what we came out with in a guidelines in the 2021. Same thing is applicable now. We need to look at Omicron is a very mild infection. We need to open. There is we have a very clear stand on school reopening is concerned.
So then I would just like to add a follow-up question to that, which is just an extension of my previous question. So would you say that very comfortably right now, if we just look at the pathology of the disease, that the children overall are okay in terms of the severity of the disease? Are you coming across many children who are having severe cases, especially the younger ones who are not yet vaccinated?
Yeah, this is one of the clinical questions. What I spoke is about an organization I spoke. Now let me talk as a clinician, what we need to be looked into this. See, as far as the COVID infection is concerned, in the first wave, children were asymptomatic, not much symptoms. Most of the time it is a coincidental thing. In the second wave, we did get some of the kids is affected with the COVID infection, especially less than 1 year, between 12 to 18 years. These are the group with a comorbidity getting admitted to the hospital. Coming back to we are in the middle of the third wave. What really we are experiencing in the Omicron is, yes, children are getting infected, developing an high-grade fever, sore throat, headache, body ache, mild upper respiratory tract infection. So this Omicron is not causing any severe pneumonia, and admissions is mainly because of a co-infection rather than an infection which is caused by a Omicron is not causing an admission. It is the co-infection which is causing an admission. So overall, till now, we are yet to say these things. Since we are middle of the third wave, it is not really dangerous at the moment. Whatever the experience we have got it in the last 1 month, so it is we can open the school.
I think that's something that most people are aware of, but it's always reassuring hearing that from a doctor who's actually working with children as well. So Abantika, I want to ask you, what's the mood like right now with the government? What do you think the government might do, or different state governments might do, excuse me, if you go by the case numbers and the way the restrictions are easing in different places?
Right. So I believe the thinking in the government is that, and I have been talking to some senior people, the thinking in the government is that schools should be opened with adequate vaccination of staff by staff, I mean everybody, driver, conductor, teacher, everybody, double vaccination of staff in classrooms that are well ventilated, so that, and to enforce the mask rule very stringently, not just with teachers, but also with students and everybody. So that's a difficult ask, I can understand, but here's the issue. When we keep, it was one thing to close schools in 2020, but right now the thinking is that, see, this is going to be there. It's been 2 years and it's not going to go away. And if we are going to learn to live with the virus, then a very important part of that learning also is for our kids to learn to live with it, for our kids to understand that you can't remove your masks. It's very important. Also, if there are concerns about kids spreading it to their family members, that's why we have started the precaution doses for the vulnerable. So I think, in fact, I am told that the government of India is seriously looking at an advisory for states, for opening of schools, so that more states take that decision. Some have, Maharashtra, for example, has opened schools. But I believe the thinking is that it's time most states did that.
Okay. I think at this point, I'll also start taking in some of our viewer questions. Ms. Preeti, so Nimit Arora has a question. He says, why are we focusing on opening schools in the first place? Children are not vaccinated. You cannot expect them to follow protocols stringently all the time. And it was specifically said by experts that this wave can target young people. Now, I just want to add to that, we are aware that we are not seeing a lot of severe cases, but considering we still don't know the effects of something like long COVID in children, how safe is it in general in terms of the responsiveness to this pandemic to start sending kids off to school en masse right now?
So this is exactly what I said when I spoke previously, that children are vulnerable. So we've been very careful. But as Dr. Vasuraj said, that the level of infection is not seen to be too serious. But nevertheless, a ill child in the family is a matter of great concern. Having said that, now between 15 to 18 years, 60% of the eligible children, because they are minors, are already vaccinated, as you know. These figures are there on the MHFW website. So the states are taking decisions. They have been announcing, as Bantika said, Maharashtra has reopened from 24th of January. That's the date. And also now Haryana and Chandigarh have announced that they will be opening schools from 10th to 12th from 1st of February. So therefore, I think a graded approach, depending on the situation in the state, depending upon the vaccination status, depending on the precaution dose that has been given to the elderly, schools can reopen. But I agree that our children's health is a major concern. But then, children sitting at home, spending so much of screen time, having mental health issues because they are not going out and all, that also is an issue. So it has to be a balance. That's what I'm trying to say.
Thank you. Thank you, Ms. Preeti. I think that is also most people's concerns as well, because while we do understand that children have to be safe from the disease and your instinct is to keep them at home when you're also at home, there's also the additional concern of their development and all the cognitive effects that might even accompany it at such a tender age as well, which might play a huge role later on. Dr. Basavaraj, so now if kids start going back to school, obviously they're going to have to follow COVID appropriate behavior. Given your experience in dealing with kids and talking to them about disease, what's the best way to go about explaining to children the risks of COVID, especially when they're really young children? And in fact, I think one of our viewers also asked, Rajan asks, how can COVID appropriate behavior be monitored in children in schools? Kids may not always stay masked.
See, as per here is two things. So I'll answer this question in the two part. First part, as a parents, definitely majority of the parents has a concern. If I send it to the baby to the school, if my baby gets a COVID infection, the education is not important. It is the health is the most important thing. That's what generally as a human being we think. Absolutely, I'll agree with that. But reassuring fact is one, whatever the clinical experience we have got it in the last 2 years plus. So the infection in the kids, it is not severe. That's the one of the thing. As far as the long COVID is concerned, in the Delta, we got it what you call it as a multi-system inflammatory syndrome. That is 1 in 1 lakh of a kids, 1 in 1,000 cases of a thing. If you recognize, and we have sensitized so much pediatrician across India regarding multi-system inflammatory syndrome, it is a disease where you can identify, you can treat it. It will not cause any mortality and morbidity if you recognize and treat those things. That's also very rare, but it is treatable condition as far as the long COVID is concerned. Apart from the multi-system inflammatory syndrome, as far as the long COVID is concerned, we are not getting anything in the pediatric at the moment. That is one. Coming to as an parents, yes, we need to reassure the parents. COVID appropriate behavior. The mask is the one thing which is advised after the age of 5 years or so. So especially once if you educate the kids wearing the mask and all, kids are strictly follow the discipline. It is not a difficult task. Most of the time they will listen to the parents, they will listen to the teacher. So educating the COVID appropriate behavior is not a difficult task. We can do that in the school as well as in the home. So I can assure you, whatever the scientific literature which is available, it is not my personal experience. Children are not the super spreader. Severity of the disease is not that in the case of a pediatric age group less than 18 years. And vaccination is freely available for 15 to 18 years. Almost 60% of the vaccination has been covered. This is already brought out by Preeti Madam also. So, and also the Covaxin, which is approved between 2 to 18 years. You must be wondering why it is 15 to 18 years has been given a vaccination. Why not in the down age? Because when you are policy making things, generally we look at the risk of the disease and the availability of the infrastructure with us and how we can utilize that judiciously. When you look at less than 15 years, it is not that severe. That was the reason why 15 to 18 years age group has been taken into the consideration. So hopefully government of India will roll it out for less than 15 years also. But the risk group is taken in the first thing. I can assure the parents, so it is not a severe disease. Please take a time to send the kids to the school. That's the need of the hour. COVID is not dangerous. You are not sending the baby to the school. That's more dangerous.
Thank you, Doctor. Avantika, speaking about vaccination, can you tell us what the numbers are looking like and what the numbers are expected to look like for children's vaccination right now?
Okay, so I will, let me just sort of open this. We are 60%, over 60% in the 15 to 18 year category have already got the first dose of the vaccine. That's the latest figure. Also, what I want to talk about a little bit here is that vaccination is one thing, but there is, and this point was actually highlighted yesterday in the DDMA meeting by NCDC Director Dr. S.K. Singh, that, see, we have data of age-wise breakup of deaths, at least governments have, but state governments have not been keeping a database of cases as per age. That is a concern. And that was actually flagged by Dr. Singh yesterday in yesterday's meeting, that unless we have that kind of data available epidemiologically, it becomes very difficult for us to sort of take a decision. And also, there is this thinking that since 15 to 18 years vaccinations are happening, then maybe schools should at least open the classes from 9 to 12, which would be 15 to 18 years. They should start opening because they have these 60% of the kids already have some sort of protection.
Got it. Thank you. I think We do have more viewer questions. So one of the things, Ms. Preeti, is so when we look at just children cases among children, how has it compared in terms of how effective the healthcare has been for severe cases among children internationally and in India? Is that something that we are aware of right now? Do we have data for anything like that at the moment?
See, just Avantika had pointed out, and I would also like to reiterate that we do not have age-wise breakup of cases. And actually, it's true across the world, because you see what's happening is we are dealing, you can't expect also the states, the doctors, and the nurses who are in hospitals to cull out this data immediately. I'm sure that the data is there because you see a patient history is prepared, and but it has to be collated because they are dealing with the numerous cases. They are, for the last 2 years, you see our medical fraternity has been working overtime, getting infected, also I would say sacrificing family life. So that data, but epidemiologically, that data is very, very important. So we do have that data. It's there in the hospitals, it's there in the nursing homes, but it needs to be collated. So this call that has been given by Dr. S.K. Singh yesterday, I think the states will bring out that data. And I'm sure that Dr. Saab will also agree with me that age-wise history sheets are available. But I just want to say that, already in India, 4.44 crore, children from 15 to 18 have been vaccinated. So the states are slowly reopening for the higher classes, and let it be, the choice of the parents and the child to attend the school, so that you can have a hybrid model, so that slowly confidence will build in. And you had asked Dr. Saab a question as to how to ensure COVID appropriate behavior in schools. So my experience internationally, and what I have seen as health secretary also, the checklists work very well. So you see the school education department guideline that I was talking about, the October, the first, I think it was the 5th October 2021 guideline, also talks about checklists. So let there be a ready checklist with the teachers, with the principal, with the bus driver, with the parents, so that appropriate behavior can be ticked off, and the inappropriate behavior can be highlighted. So that's one way of doing it.
Thank you. That's actually very useful. It was not something that I had instinctively thought of as well. Instead of getting the kids to understand the science behind why something works and why they need to behave a certain way, give them a checklist to tick off of. Dr. Basavaraj, we have another viewer question. Rahila asks, how is the immune system of young children in this pandemic being affected by lack of exposure to outside environment because of quarantines and lockdowns and things?
Yeah, this is a very, very interesting question. See, when we look at a kids which has been confined to the home, what you call it as an immune depth. Immune depth is one of the important thing what we have come across in the recent past, last 6 months to 8 months, where majority of the kids of less than 5 years, immediately after the second wave, they started getting an infection with other viral infections like RSV infection, influenza, and parainfluenza. Why do they get all these infections? Mainly, this infection is because of viral infection did not occur in the last 1.5 to 2 years because of a COVID appropriate behavior, where the RSV, the kids did not expose to the RSV, influenza, and parainfluenza virus. So we had in 2 months, in the month of almost in the September and October, we had an RSV viral infection, which was causing a much more severe disease than that of in a COVID-19. Somehow we could be able to gear up to that within already lot of health infrastructure has been created by the government of India as well as the state governments. So we could be able to cope up with that. Similar way, so if you don't take expose the kids for the routine infections and things, immunity depth is going to be created. So it will create a more infections. So that is the reason why it is a right time to think expose the kids, take an appropriate behavior in a staggered manner. Better to expose the kids for a natural infection.
Okay. Abantika, we have a slightly sidestep question for you. Vineet Saigal asks, when are we getting Corbevax and Zycod D in the market?
In the market? That's, so, the first step would be there coming into the national program. We are not even getting the existing ones in the national program, Covishield and Covaxin, in the market anytime soon. That has been made very clear by the Ministry of Health yesterday, and during my interaction with officials there, it's very clear that it's not going to be soon. So for Zycod D and Corbevax, I think the first step would be they're coming into the national program and then the market. So I'm sure we are looking at quite a distant future.
Okay. Ms. Preeti, Shyam has a question for you. He asks, how do we strike a balance between the slowing economy and the continuing shutdowns amidst COVID-19?
Yes, Shyam, this question is in everybody's minds, including the government, I'm sure. This dilemma of saving lives or saving livelihoods has been actually paramount since the last 2 years. And the choice is very, very difficult. I'm sure that now with lessons of 2 years, slowly, if all of us, and I say including me, because it's us, if we follow COVID appropriate behavior, we also have to fine tune the way we work, the way the economy will prosper, and the way actually each profession will actually pan out, including, I would say, the vendors, because they've lost their livelihoods. How they will also need to ensure that they are safe and others are safe. So with all this learning, I'm sure that we will find our way, and we are waiting for this third wave to slow down, and I'm sure the economy will open very soon.
On that positive note, we've also run out of time, and thank you so much to our guests for joining us. I hope our viewers had some very good and informative takeaways from the session, as did I. Thank you also to our viewers for taking time out to join, and please do join us once again for the next edition on Monday. Thank you, Ms. Preeti, Dr. Baswaraj. Thanks, Abantika.
Thank you.